So I've been here at Core Physicians for 20 years now. It was the second job I had out of residency, and as you can see, this has been really the only place I've grown up, and it's been a great organization throughout the 20 years. The reason I chose Core Physicians was when my wife and I were both looking. She's an internist here at Core as well. We were looking for the right organization with the right size, the right feel, and right from the moment we got here, it felt a lot like family. And that was, again, 20 years ago, but even since then, we've grown exponentially, and yet it still feels like home.
I've been practicing medicine with Core Physicians for 3.5 years. I chose to practice medicine with Core Physicians because of its impressive reputation within the community and its impressive group of providers and very supportive leadership.
Our primary care team has grown in many different ways over the last 15 or 20 years, particularly in the last 5 years. We have integrated behavioral health. We have a care coordinator now who's a registered nurse, and that person has been integral as far as reaching out to patients with any transition of care, from the hospital to the outpatient setting, from the nursing home or long-term care to the outpatient setting. They provide just another look for those of us who are providing primary care. In addition to that, the behavioral health nurse and the social workers have been critical as far as helping us manage those chronic care conditions from the mental health standpoint. And the other thing that has been really an impressive growth for us has been development of our advanced practitioner clinicians. So our nurse practitioners and our PAs, and they are as important as anyone else now.
My role as the care coordinator, we work with all members of the primary care team. We work with the triage nurses, we work with the medical assistants, we work with the physicians. We're lucky enough to have social work on our team as well. And we are communicating daily with all the members of the care team to make sure that the patient is getting what they need at home, and that when they return home from a hospital or rehab setting, that their medications are correct, their appointments are correct, they have visiting nurse services if needed, and then we also work to support their social needs as well. We also, as care coordinators, we have a chronic disease management program where we can enroll Medicare patients in disease management, and we follow them over time to help reduce emergency room visits, hospitalizations, and just kind of support them the best that we can.
When a patient comes in to see their provider for a physical or follow-up appointment of any kind, through their interaction with the doctor might discover there's something else that's contributing to their condition, or they've got a lot going on in their life that they might need some support with managing. So at that point, the doctor will come knock on my door and ask me to come join in his or her appointment with the patient, and introduce myself to the patient and let them know what kind of services I provide. And that way, the idea of the warm handoff is that a patient can leave with a face and a name of somebody that can help them through whatever concerning thing going on in their life. Because most times when something is going on with a patient, they'll get a list of names of different people that they can call, and a lot of times they're not going to call and get that help.
The teams that are created within Core Family Practice have typically a nurse practitioner or a PA assigned to the physician. We're able to have a seamless transition from appointment to appointment. We do a really great job as a team working with our patient population. If any of us has a question about a patient either coming in or that we had just seen that maybe another one of us has treated in the past, we're able to have that seamless team approach and continuity of care for our patients, and they expect that and appreciate that.
One of the things that I should convey as far as primary care and Core is that people work together very collaboratively, both from the primary care division, but also with the specialty care that we have here. Then, of course, given that we are an integrated health system, we have a lot of ancillary services, physical therapy, occupational therapy, and all these help us from a primary care standpoint provide proficient care to the patient. The thing about core physicians here in New Hampshire is that it's still, despite us providing first-class care at what is considered to be, most people would say, a community hospital, we provide what seems like tertiary care in a lot of settings. And that is a testament to the commitment from the organization. It also, despite that level of care, we still feel like a community hospital in different ways, whether it's the collegiality, the connections we have with our patients. We have a lot of patients who go down to Boston or Dartmouth and other facilities, and they don't feel like they get the same exact care there as they do here.